Muy buenos días, buenas tardes a todos. Good morning, good afternoon, bom dia, boa tarde a todos. Mi nombre es João.
My name is Juan Marcelo Furtado. I'm advisor for visual health at PAHO in the Americas. And I thank you very much for your time, for your participation, and for your interest. We will be with you for the next 90 minutes debating something that is very relevant to the region, which is the issue of refractive errors. And we are going to introduce the SPECS initiative to 2030. It's PAHOS. And we're very glad to be with Dr. James Fitzgerald, who is the Director of Health Systems and Services at PAHO, and Dr. Cafe, who is the interim head of Course of Life and also on adolescent health, Dr. Stuart Kier, who is advisor on visual health at WHO. And we'll also have Sofia Maldonado, representative of Ministry of Health of Paraguay. I now pass the floor to James.
Your welcome speech. Thanks again, and please take the floor.
Yeah, thank you very much, João. Good morning to you. Good morning to all colleagues, partners, and friends. I'm really delighted to welcome you to this regional launch of the SPECS 2030 initiative. A very special welcome to representatives from all the ministries of health from throughout the Americas, and especially to our invited panelists today, Dr. Sofia Maldonado from the Ministry of Health of Paraguay. Really, thank you for joining us as we take an important step forward for eye health in the Americas. Colleagues, the data speaks for itself. In Latin America and the Caribbean, close to 78 million people live with vision loss. Of these, 3.7 million are blind, and another 24.5 million live with moderate to severe impairment. These are just not abstract figures. They represent children who cannot learn to their full potential, adults who are unable to contribute fully in the workplace, and older people who lose independence and quality of life. The burden is especially heavy among older adults. In our region, 14% of people over the age of 60 live with moderate to severe impairment, and almost 3% are blind. In the Caribbean, two highly preventable and treatable causes, uncorrected refractive errors and cataracts, account for more than half of vision problems among older persons. These are conditions we have the tools and knowledge to address. The social and economic costs of this situation are profound. Vision loss limits educational achievement, reduces poverty, reduces productivity, and undermines participation in society. If we continue at the current pace, universal access to eyeglasses will not be achieved until the end of the century. In a region where disparities are so evident, we cannot allow this to continue. Across the life course, from childhood learning to adult productivity to healthy aging, vision underpins opportunities for individuals and resilience for societies. This is why the SPECS 2030 initiative, services, personnel, education, cost, and surveillance matters so much for the Americas. It provides a framework to accelerate progress towards the global targets adopted by the World Health Assembly, namely by 2030, a 40 percentage point increase in effective refractive error coverage, and a 30% point increase in cataract surgical coverage. But more importantly, it gives us tools to address the inequities in our own region. It encourages us to integrate eye health into primary health care, so rural and underserved populations have the same access as urban centres. It encourages us to invest in workforce training, so providers at the first level of care can detect and manage eye conditions early. It promotes the expansion of affordable access to glasses and cataract surgery, reducing out-of-pocket spending that keeps families in poverty. It promotes the building of robust data and surveillance systems, so decision makers understand the true scope of the problem and can target interventions. And it encourages us to raise awareness so that people seek care before vision loss becomes irreversible. The Americas faces challenges: persistent gaps in coverage between countries, limited availability of services outside major cities, and financial barriers that put even basic care out of reach for the poorest families. SPECS 2030 gives us hope, gives us structure to close those gaps and ensure that progress is made, not just globally, but here in our region for people who need it most. Today, we will hear more about the initiative's relevance for the Americas, as well as national experiences, such as those from Paraguay, that show how action is already underway. So, colleagues, let us remember improving vision is not only about health, but also an investment in human capital and development. Correcting a child's vision allows them to succeed in school. Helping an adult access glasses or surgery keeps them in the workforce and supporting their family. Restoring sight for an older person preserves their dignity and social participation. In every case, eye health multiplies opportunities for individuals and communities alike and contributes directly to achieving the Sustainable Development Goals. The evidence is clear. Human, social, and economic returns on eye health are among the highest of any public health investment. The Americas carry a heavy burden of vision loss, but we also have the opportunity to lead the way in implementing solutions. With SPECS 2030, we now have a practical and structured approach. Let's use this launch to build momentum, mobilize political will, and work together toward national roadmaps that reflect our region's realities and priorities. Thank you very much for joining us.
Thank you, James. Antes de la presentación del doctor Stuart.
For the presentation by Dr. Stuart Keel, I'd like to tell you that the presentation chat is available for you. There won't be any possibilities of voice questions, but you can ask questions through the chat. So if you want to comment or ask questions, you can ask in English, Spanish, or Portuguese. And I also comment that after the event, we're going to prepare and share with you a summary, a report summary. And we're also going to share links of WHO documents we'll mention in the presentation through the chat. And after the presentations, and we'll have some time to discuss what is the route for interested countries, what they have to do so they can develop the activities aligned with SPECS in your own countries. Now, I invite Dr. Stuart Keel.
Stuart is the advisor for vision care in WHO, and he's constantly and since the beginning, since the inception of the SPECS, he's involved in all aspects of it. So there's no better person than Stuart to be here and to give us an overview of the initiative. And also Stuart will be with us discussion later, discussing examples and what are the countries from other regions are doing. So Stuart, thanks again and welcome.
Thank you very much, Joe, and thank you to James for the great introduction. So, yes, for the course, the next 10 minutes, I'd like to just give a brief overview of the SPECS 2030 initiative. As Joe mentioned, this is an initiative that commenced at headquarters only about a year ago, but has gained some significant momentum, and it's great to see so many interested people online today. So, before we start giving an overview, I thought it would be worth just reflecting on some of the global figures around refractive error and why this initiative came about. And really, we know that there is a huge need for care when it comes to refractive error. It's universally the leading cause of vision impairment in both adult and child populations. And we just have to look at the two leading reasons for people needing services and eyeglasses to understand this. It's currently estimated that globally over 2 billion people are short-sighted or have myopia, and close to 2 billion people have presbyopia or near vision impairment that could be corrected with a pair of near vision glasses. So we're talking conservatively about a third of the world's population in need of ongoing access to eye care services and eyeglasses or other interventions for refractive error. And to confound this problem, it is growing. This is really growing in childhood. Myopia is growing due to lifestyle-related risk factors such as intensive near-work activity and less time spent outdoors, which is driving increases in short-sightedness in our younger population. And of course, presbyopia is closely linked to aging, and our populations are aging, and therefore we are seeing an increase. And as pointed out by James, there has been progress that has been made. However, at the current pace of progress, universal access to eyeglasses is not going to be achieved until the end of the century. So based on this huge need, based on the growing need and this significant public health problem, but also the very cost-effective solutions that we have at our fingertips, WHO's response to this is the SPECS 2030 initiative that was launched in May 2024. So only just over a year ago, really bringing together key partners in the sector to engage them from the start, including NGO, academia, governments, on how we shape this initiative moving forward. It has the mission of supporting countries to achieve the 2030 target on effective refractive error coverage that James mentioned before, but just reinforcing what that was. It's a 40 percentage point increase in effective refractive error coverage by 2030. As mentioned, SPECS sets out quite a straightforward framework for country action, and it's under 5 strategic pillars that it does so. And those strategic pillars here are outlined in the darker yellow hexagons on the screen, in line with the SPECS acronym, starting with improving access to refractive services, then building capacity of personnel. This is strengthening human resources pillar. There's also improving population education, which is also around demand generation, myopia prevention campaigns, etc. The fourth is around cost, reducing the cost of refractive services, and of course, strengthening surveillance and research. For each of these 5 pillars, there's a set of country-level desired outcomes that are beside them that, if achieved, would result in a sustainable increase in refractive error coverage in countries. So I'm not going to go through each of those now, but we can certainly share this after the webinar. It's available on the WHO webpage, but just wanted to emphasize that this is all about creating sustainability and strengthening refractive error services in countries, building sustainable services. Of course, WHO can't do this alone and doesn't plan on doing this alone. A collaboration and coordination is really needed across all stakeholders, and the SPECS initiative has 4 separate areas of engagement that it will focus on and is focusing on to support the achievement of the mission of the initiative. And they're outlined on the screen here, and I'll just briefly go through each of those now. The first one is the WHO SPECS normative work, which is in the context of WHO's usual role, which is to develop normative guidance for countries to help support planning and implementation. And after engaging with a huge number of experts over the last few years, WHO has launched in the last few years and even more recently a range of tools, evidence-based tools to support country implementation for each of these SPECS pillars. And again, I'm not going to go through all of these now for the sake of time. I'll be covering off on a few more later in the discussion today. But just to say there's quite a number of resources that are available to help support planning and implementation in different areas: screening, awareness, demand generation, training, etc. The second key pillar is this global SPECS network, and this is a network bringing together a network of stakeholders. There are quite a number of stakeholders in this space, both at local, national level, but also international level, to really promote coordinated advocacy on the topic of refractive error. And so far, there are 42 members of this WHO SPECS network. You can see some of these on the screen, ranging from NGOs, academia, UN agencies, other philanthropic agencies, really coming together. We have a specific advocacy-based work plan around different topics that we're currently working on in a unified manner with these stakeholders. Just to say that if there are any interested organizations in joining the SPECS network. Applications are actually open through the WHO webpage at the moment, and we'll be taking a new organisations in early in 2026. The third key area, which is particularly relevant for refractive error, is engaging with the private sector to seek meaningful contributions, given a large chunk of refractive error services globally are provided through the private sector. So WHO has made some progress on this front. We've currently engaged with around 20 entities. WHO recently held a meeting in Geneva, bringing together many of these entities to talk about a range of contributions to this space, including data sharing, technology, awareness, demand generation, but also country level support as well for national level initiatives. And lastly, but certainly not least, the most important area of engagement in why we're actually embarking on this initiative is bringing all of these contributions from the global level down to a country level where we want to see the action. And we're very pleased to see so far the demand from governments for country level initiatives, whether it be national or subnational, with already over 20 countries moving forward with the initiatives and a number of other countries in the lighter yellow color in early planning stages for national or subnational level initiatives. So as you can see, there are some regions such as Southeast Asia that have really been quite active in moving forward. And building in other regions as well. And we're hoping to build this initiative and have other countries coming forward where WHO and other partners can support these initiatives moving forward. So in summary, although the data at the start that I presented does paint a huge challenge in front of us and the need for acceleration, there really is solid progress that's been made in a number of areas, and there is space now for optimism. And the reason being is that we have a good solid data set now for advocacy and action. We have many of the WHO tools and technical guidance to support country implementation. We have a united and growing stakeholder group that are coming together to help support this cause. There's been a strong country demand, albeit in the early stages of the initiative, but now it's time to capitalize on this momentum and really scale up our efforts to address refractive error. So with that, Zhao, I'll stop and hand back over to you and come back to talk to you later.
Excellent, Stuart. Many thanks for this wonderful presentation. I can see from the chat that Brenda shared many useful resources, and also that we have one request from Rosario Barrenechea for us to share the presentations. We will do it that later. As soon as we finish, we will prepare a short summary, and we will share documents and presentations. Bueno, Stuart nos brindó.
Stuart provided us with an excellent presentation about the global initiative, including the 5-point barriers and opportunities. And now I have to speak in a more individualized way, that is for the region. All of us here in the region have of course, an idea of how important this issue is, but it's not something subjective just for us who deals with eye health. There's evidence and many points I need to mention here. Besides barriers, we also have opportunities to act. There's a lot of evidence about refractive errors as a cause of visual deficiency in the region, as James and Stuart mentioned. An important cause for low vision is presbyopia, and among moderate and mild problems, we have refractive errors at global level, but also in the Americas. About 21% of people in the Americas require glasses to see better, whether from far or from near, and they don't use these due to a number of barriers, so we have room to improve. There is a lot of evidence, and this has been very well studied, that eye intervention compared with other interventions, it has a very high yield. You save in different points in society per each dollar invested. If you invest in eye health, it's much more cost effective as compared to other actions in health. We also have evidence about the fact that in the Americas, we are progressing in coverage and quality of services. That is known, but as Stuart told us, our pace is lower than desired to achieve the targets we have for 2030. Stuart has also mentioned that despite the fact that we are progressing, demand for services due to growth of myopia and presbyopia, it will impact services, and we have to change what we do. An advantage we have in refractive errors is that we do have the knowledge to diagnose and treat these refractive errors. And you don't need to invent any new drugs or invest a lot in very sophisticated matters. Professionals know how to detect and treat, and we have good quality lenses that can help a lot and restore the sight of people who have lower sight because of lack of glasses. We have indicators, targets. Indicators have to do not only with coverage, but also quality of services. In this cases, refractive errors. And as Stuart, the countries have signed an agreement about this target and increase of 40% in effective coverage of refractive errors to 23. I've already mentioned that we are progressing towards this, but slower than desired. We have excellent professionals, optometrists, ophthalmologists, technicians, practitioners, assistants, despite the fact that we have problems in terms of head counts and distribution of healthcare personnel. I'll show you opportunities for improving this. So we see the evidence, we see the barriers, but we have lots of opportunities to act. There is much interest among the population about this. You don't need to convince people that about the fact that they will improve their sight with eyeglasses. They want to improve their eyesight, and interventions are cost effective and well accepted by society. And we do have the possibility of restoring sight with a simple couple of eyeglasses in front of the person's face. We have PAHO and WHO technical support. At PAHO, we are available for use so that all member countries, all ministries request support from their country offices, PAHO country offices. And we have a structure for technical support. As Stuart already mentioned, we have all the necessary tools to do situational analysis that will tell us what we have to identify as barriers and challenges so we can act. Concerning human resources, we can insert eye care in primary care programs that are generally well developed in the region. So we have a strong point there. We can have this support to progress on refractive errors. To conclude, we have evidence, and it is um, certain that we have progressed in the last decades, but we still have refractive errors with a very high impact in society as the main cause of visual deficiency, either from close or from far. We are acting and progressing, but the pace is slower than we need. So SPICS is coming to support countries to organize activities because governments and ministries cannot achieve the targets in an isolated way. The same thing goes for um, nations, um, private parties, etc. We have to all coordinate and support each other. We're here for you. Thank you very much for your attention. Well, once again, please ask your questions or make your comments through the chat, and we'll have some time for that. Now we'd like to present national or domestic experiences. We'll start with Dr. Sofia Maldonado, who's representative of the Ministry of Health of Paraguay, which is the first country in the Americas. Um, I had the pleasure to be in Paraguay in June. And since that launching, we are in contact in Paraguay. Besides the text, as Dr. Maldonado will present, Paraguay has also other activities concerning eyesight health. So Dr. Maldonado, once again, I ask you to share your screen and start your presentation. Can you see my presentation? I can't see it. I don't see it in my computer. Please tell us if you can see it. Can other people see it? It's on the screen now. Good morning, everybody. Thank you very much for this invitation to participate in this virtual launching of the STEPS initiative. I'm going to speak a little bit about Paraguay's experience concerning becoming incorporated to this initiative and other initiatives we are carrying out at the Ministry of Health of Paraguay through the National Program for Eyesight Health. Why did we decide to partake in this initiative? Paraguay is not away from the crumbs of refractive errors. It was the first country in the Americas to carry out blindness quick evaluation, REX 1999, where the impact of refractive errors was evidenced as one of the main causes of visual deficiency in the country. From then on, the country has carried out different actions to strengthen everything referred to visual health. In 2002, we created the first national eyesight committee in Paraguay, integrated by governmental and non-governmental entities as well as private entities. In 2008, the national program of eye health was created as an independent division of the ministry, and we launched the national plan of ocular health in 2009. During all these years, we have counted on the participation and support of different organized non-governmental NGOs, both domestic and international, in the work we do on visual health in the country. This resulted in a second survey, a national survey in 2011. This was the national survey on preventable blindness, and it was called RAP. Among the actions carried out in the national eyesight health program. The program has received through the Department of Defense and the South Command of the United States the donation of 16,000 pre-graduated lenses and 200 glasses frameworks to work in our itinerating programs.
We need to move forward towards the goals that we have towards 2030. We're going to be working in coordination, performing in coordination with PAHO to develop different activities related to visual health. And we have generated a tool for analysis on substation and ophthalmological health in the country. And we have done a relaunching in June, like Dr. Joao mentioned, of the SPECS 2030 initiative. And we have completed our third fast survey of RAP. This is the country that is doing, we are a country that is doing this for the third time to analyze the status. And all of these works are going to help us to see what would be our ophthalmological program towards 2030. And we are going to be seeing all of these pillars. Like we have discussed, Dr. Joao was in Paraguay. We were developing a workshop of SPECS initiatives with the involvement of different entities, with different authorities from the Ministry of Public Health. We were there as members of the program of basically involving the health of eye health or ocular health. And within this workshop, we had 5 technical groups, and we were focused on the strategic lines. And each group formulated their own investment proposals with an institutional head. And these were the groups that we just created. We have a head or responsible for each group. When it comes to human resource training in primary healthcare, we have Dr. Miriam Cano. She's representative of the Ophthalmological Association and president of PRONAVIP. When it comes to optical sustainability financing, we have Olivia Gomez. In the education and visual health promotion, we have members of the Lions Group. We have Master Gladys Arzamendia, we have Lidia Gonzalez and Susana Olivarri. When it comes to monitoring, surveillance, and service quality, we have me as head, right? Sofia Maldonado. When it comes to EXAT, the refractive error data mentioned that we need a bigger effort. We need to work along these lines. We actually do not have the required data to measure coverage. And we are working in tools, in this case, that could help us do this. We need to apply TARES, and we need to implement governmental mechanisms for goals to be accessible to population. And of course, all of the lenses that were donated by the embassy is going to help us for vulnerable population. We are also working on acquiring glasses or lenses from the eye health program from the Ministry of Health. We have students, for example, that have incorporated in such plans for schools, and the optical services are not integrated within the public service. We are trying to compile data, and we need to see if we're actually complying with this role. when it comes to the general data of the program, we could say that between 2022 and 2024, we have donated 7,000 lenses, and we provided a program as well. And I think that we have benefited more than 50,000 people. We are encouraging a project and thinking about Aprendo Mejor. This is a project in which the eye health program will be one of the pillars that supports Hunger Zero for schools. This is a food program that involves all of the institutions. We're talking about 7,000 institutions, and this translates into 1,200,000 students. We're actually training teachers and members of the family units when it comes to the country. And we also have audiovisual materials. So that means that the teachers could be trained. We actually provide some testing cards in order to perform this at schools. And if we would require reevaluation for the students, they would be listed, and we work on evaluating the children. And then this is also involving the ophthalmologist. For example, if children require more specific care, they will be referred to the hospitals with ophthalmologists. They're going to be referred to other healthcare systems in alliance with other institutions. Now, when it comes to the general data on eye health, when it comes to public health in Paraguay, we have 22 services in Paraguay. 21 of them are permanently installed with hospitals of different regions in the country, and we have a healthcare system that depends on the program, and weekly we have care for the people in the regional area of the country as well. Out of all of those services, 6 have received new equipment. We have machinery for testing. We have a whole series of services that we still need to re-adequate in this sense. And we have more than 70 ophthalmologists working in the visual network. So the next steps that we want to continue with regarding with these initiatives would be having monthly meetings with the work teams, having introductions of the proposals, and starting from November, we're going to have monthly counseling with WHO and PAHO in order to apply our own proposals starting next year's. So thank you, everybody. Thank you, Doctor. And this is an excellent presentation. I want to congratulate you for all activities because you are working towards the eye health in Paraguay. We're going to see some examples from other countries. We're going to have a moment to answer some of the comments and questions on the chat box. And we're going to be having some Q&A session with Dr. Maldonado related to eye health and specs in Paraguay.
Now, Dr. Stuart Keel will present some of the international experiences on the specs initiatives. Stuart, thanks, and please take the floor.
Yeah, thank you again, Zhao. So just sharing my screen here. So I think that was an excellent example, I think, from Sophia in Paraguay to show how the specs initiative can be successfully kicked off, planned, and also demonstrating tangible process with regular review Building on this, I just wanted to provide a brief overview of the process followed in most countries when they commence a SPECS initiative, and also highlight a few country examples as I go through as well. As mentioned before, in my previous presentation, we're very pleased to see the demand from governments for country-level initiatives is strong. A range of countries, close to 30 countries, have now at least expressed interest, some moving ahead with already at the implementation stage as well. And there's no exact formula in terms of moving forward with an initiative. Of course, we recognize that countries are starting at very different stages, and depending on what stage will depend on what process is followed. But the general steps that countries have followed for kicking off SPECS initiatives in countries and planning for SPECS initiatives are outlined in the 5 steps on the screen here. And firstly, most importantly, the country, including key government stakeholders, need to agree that refractive error is a priority for them. And the second stage is really bringing together the evidence, existing evidence on the topic, potentially conducting an additional situation assessment on eye care refractive error services in the country to support planning, before then bringing together stakeholders for a convening to define the country priorities, developing a work plan. And it's important with this work plan that it not only identifies key priorities and activities, but also targets and a solid monitoring and evaluation framework. And most importantly, we don't want this to be a sort of a standalone effort where we're looking for integration. We need this plan and these activities to be integrated into broader eye health plans, potentially even broader plans, including NCD-related plans within countries. And then the final stage, of course, is implementation. And a good example, in addition to implementation, as we've seen in Paraguay, is having regular, at least 6 monthly meetings to review progress, and even potentially more frequently as well. So WHO has been tending to play a very supporting role in stages 2 to 5 in many countries. And just to go through now, in terms of the second step, collating evidence, conducting a situation assessment on refractive error and eye care services in a country, WHO has 2 specific tools to support this step. We'd mentioned those before, but specifically highlighting them now. For eye care in general, there's a situation assessment tool called the EXAT, and for refractive error specifically called the RESAT. And this tool specifically provides a comprehensive assessment of services within the country and answers what's the current situation, strengths, weaknesses, inequalities, and also what are the priority areas that need to be addressed, which really places us together with epidemiological data and other data within a country in a very solid position to then move forward with the planning stage. And with those stakeholder meetings, here's just a few examples on screen here of where these efforts have been kicked off. There's a number of other countries that have kicked off that we don't include on this screen, several here from the Southeast Asia region, also the Western Pacific region. The important thing to emphasize here in these stakeholder meetings is where appropriate to bring together all relevant stakeholders in countries, including, not only Ministry of Health, Ministry of Health, WHO, but other relevant ministries that can be involved in this initiative, such as the Ministry of Education, also NGO players, non-government organizations within the country, professional associations, and also, where appropriate, private sector as well, so that we are undertaking comprehensive planning with all key stakeholders from the sector. So the idea is to not only launch the initiative when we come together, but also go through the evidence, and based on this SPECS framework, actually systematically look at the evidence and go through the SPECS pillars to define what the country priorities are going to be. And in addition to this framework, WHO has 2 key tools, the package of eye care interventions that really sets out what are the recommended evidence-based interventions from health promotion through to treatment for eye care, but also refractive error. And to support that monitoring and evaluation framework, also there is the eye care indicator menu as well. In terms of the implementation, WHO's role has more been around convening and coordination We'll go into a little bit more detail in a couple of slides very briefly. There's a number of tools to support implementation, to support screening, procurement, awareness and myopia prevention, workforce development, facility level monitoring. All these can be found on the WHO webpage. I won't go through them in detail now. They are available. WHO's role in countries has tended to be supporting the Ministry of Health to lead convenings with the key stakeholders, helping to coordinate the strategic plan development for refractive error, then integrated into these broader plans, supporting implementation of the technical products that we've been through, and also linking partners, both at the partners that have been established at global level, regional level, but also local partners to support implementation as well. And just to finish off this part of the presentation, I just wanted to provide a very brief example, which is a bit more out of the box model that is being trialed within SPECS India in collaboration with India Post. And a little bit of background on this is that WHO has established a collaboration at the global level with the Universal Postal Union, really based on the potential that was seen to harness the postal system's infrastructure and reach to help support scalable and sustainable models for vision care. And we do see that huge potential. There's, close to 700,000 post offices globally. In India alone, there's 150,000. So what is being trialled at the moment is with India Post in Assam state, which is a state that tends to be rather underserved from eye care services, where there is a collaboration with several postal services to offer vision screening, provision of near vision spectacles, but also importantly, connection to comprehensive eye care services for those in need as well. So this is a project that is being evaluated for its feasibility, effectiveness, and also a scalability. And we look forward to potentially replicating this model in other countries as well. So thank you very much, Jill. I'll stop here to leave more time for the discussion.
Excellent. Thanks again, Stuart. Algunas preguntas y comentarios.
Okay, we're going to have some questions and answers on the chat box, but I wanted to take advantage of the time now to ask Dr. Maldonado. She's representative of the Ministry of Health in Paraguay. I want to ask her, because she has provided an awesome presentation. She mentioned that Paraguay is planning to do many things when it comes to eye care. So the country just finished a situational analysis, which, by the way, is relevant for us to know what we need to do in order to have a basis of where we're going. Because with that, we're going to be able to work more effectively. So with that, I would like to ask Dr. Maldonado, how was the process of situational analysis? And when it comes to your country, what have you learned with experience? And what would be the barriers that you can report for the countries to consider? So when it comes to Paraguay experience, we have worked as an interinstitution. Many of the data were directly provided from the public area, and we have had many data that actually was contributed from the Ministry of Health, but there was some data that we needed to work by requesting other organizations, and all of them, they are part of the National Committee of Vision, and they contributed with their own data, their own experiences, and one of the barriers that we find by doing the survey was that we needed to implement the best data collection. We needed to standardize throughout the different institutions how are we going to collect data related to statistics, refractive errors. We needed to work with cataracts, caring for premature patients as well. All of the institutions needed to be interlinked. The Ministry of Health, the Institute of Social Prevention, the National University of Asunción, the bank, the eye health bank, for example. And sometimes we have all of these institutions and we don't collect the data properly. So that was one of the barriers that we have when implementing SAT. And we have done that with the data that we built, and with the analysis, we noticed that we needed to reinforce data as a country in order to obtain greater data and greater results, particularly to the visual health work as a country. Excellent, thank you. So for people that are not used to the analysis, EXAT is not work on the field. This is related to a work of figuring out what the country has when it comes to legislation, human resources, in order to identify strengths and weaknesses. So automatically we have a level of maturity, and automatically we would receive also suggestions for actions. And as mentioned, this is highly relevant for us to keep the benefits or the lessons learned and move forward with the weaker links. And Dr. Maldonado mentioned this because this is from Stuart's presentation. We have joint work. This is not work only from the ministry or the national society. We all need to be aligned in that sense. So from experiences in other countries, I've seen that people are uncomfortable because they don't have sort of any type of data. But remember that this is a situational analysis. If we don't have the data, this will be a result. If we don't have a result, we're going to have the task of generating data for the next report and for us to use this in the national plan. So this will be a situational analysis. This is not for, this is not to blame somebody. This is an analysis to see where we are at. Sometimes we don't have the data, and this results in the relevance of the country in order to start having it. So this is of relevance, as you can see. We have comments from Sandra Hernandez with regards to Mexico, saying that we don't have statistics in Mexico. Well, we actually have statistics. Mexico is a large country. We have a large population, and there's not a population study, as you can see, but there's studies in Nuevo León, Querétaro, Chiapas, and starting from these studies, we are going to be able to perform estimation to what's happening in all of the country. So for regions in which we don't have conventional studies, we have the WHO with Vision Loss Spec Group. We are generating data in order to have a baseline of where we're standing. And I'm sure that we're going to be able to improve this progress. We want to improve in 40% our effective coverage. So the same thing is going to happen for the countries that have not performed populational studies, and WHO can actually support us out of the two tools. that we have for situational analysis that Stuart just mentioned. We have RESAT, which is specific for some errors, and we have Alexa, which is actually a broader tool that involves things that are not related to per se as refractive, but they have their own components. So after finishing, we are going to have all the data required when it comes to human resources, laws, barriers, and such. So each country is going to be able to do one according to what they feel to and their needs.
Exact, and the reset. I meant, so the reset is relatively new. So I expect that most countries have the XSET as a database, right? So, but I understand that depending on the priorities and needs and barriers, the countries might focus in this very first moment only in the analysis of the refractive error, right?
That's to me. Zhao?
Yes, yes.
Mm-hmm. Yeah. Thank you, Zhao. I just wanted to actually put my hand up just to say that, just a very practical point, that both the XSAT and the RESAT are now available with digital data entry. So it's not a manual hard copy data entry, which makes things much more efficient. And both have been translated, both of the online versions have been translated into Spanish. And I believe, I will be corrected, if it isn't ready yet, it's soon to be ready also in Portuguese. So please reach out either through the regional office or through the headquarters if you want access to that online data entry platform for either of those two tools. Thanks, Shao.
Okay, thank you. I have one comment from Renata Moreto from Brazil saying that there's an initiative in the south of the country where there's a shortage of ophthalmologists, and they have a telemedicine system where remote ophthalmologists assist general doctors in the prescription, in the basic eye care and the prescription of glasses. And she's asking if that's a good initiative. Definitely. Of course, each country has to think about the barriers, the needs, and what's the best way to tackle the lack of the shortage of services. But yes, for Brazil, that having Brazil, a country where the prescription is a medical act, one potential initiative is to expand this kind of system. But obviously, every country should think about what's the best way to do it. La doctora Maldonado.
Dr. Maldonado mentioned that I was in Paraguay in June to facilitate the encounter on launching specs. And I want to mention something. Even though if we have tools, if we have experience of other countries, WHO and PAHO, particularly if we're with them there, our work would be to provide tools that could enable meetings and discussions. And it is highly relevant that the partners take decisions in this time, because we're going to have decisions for a country, and sometimes this is not necessarily what other countries want to do. So in that sense, I would like to be there and enable the process, but we are not having a list of tasks for each countries or a fixed list of things based on the weak or strong links. And based on that, we're going to debate with the partners related to the analysis that they have, and based on priorities and resources, we're going to be seeing what are the next phases. So, for example, things that we could define in Paraguay maybe are not similar to what we're going to decide in Bolivia or in Salvador. That would depend on the resources, weaknesses, etc. And a comment or a question would be, how can we actually have NGOs that could go closer to the national offices or branches to have ministries requesting PAHO about it? Well, basically a support that will be quite relevant in this case we can not only provide
And also
we
do
can do advocacy
PAHO
and
works under requests of the ministries of health in of the country members, of the member countries. So PAHO will support countries who want to do it, but always through their ministries. At local level, not only assistance to people with training needs, but also advocacy to convince society about the importance of the issue. NGOs, national societies, and private services can also do that, and all that helps a lot. It's very important to say once again that although we're progressing, we have to work in a coordinated way. Ministries, private parties, experts, NGOs, international examples can be adapted. All that has to be worked jointly so we can speed up this progress.
Stuart, do you want to make any other comments?
No other comments. Just to say on the last point that you made, I think in our experience, non-government organisations have really been pivotal in presenting the evidence. Local non-government organisations presenting evidence and advocating for initiatives, which then lead to that process of the Ministry of Health really coming forward and requesting WHO's technical support, but not only that, then the NGOs are, of course, very much involved in the planning process, but also supporting implementation. So they can play a very active role. One way to get engaged at a global level is through the WHO SPECS network, where you can really keep updated on all activities, tools, and share experiences, hear about experiences from different countries and how things have been successful, but also learn from some of the challenges that have also taken place in some countries. So please, if interested in getting engaged at the global level, please don't hesitate to get in touch and explore how to get involved in the SPECS network.
Thanks, Stuart. One quick question from the audience regarding the reset and the exit. Is it possible to apply both tools or not?
Yeah, so the EXAT itself will have a section given of course. So the EXAT is broader, covering broader eye health, but we will certainly have a section specifically on refractive error. So and then the reset is a deeper dive into refractive error specifically around the health system building blocks, but specific for refractive error. So it's possible to apply both. It just means that there may be some minor overlap in the EXAT refractive error section and the reset section, but that's fairly minor. But really the benefit would be to have a very enriched data set on refractive error, but also good data on broader eye health and strengths and weaknesses as well.
Okay, thank you. So my understanding is that for a country which is planning to do a broader, like a national plan, and that it's planning to do other activities, not only refractive error activities, the EXAT would be a good fit. If for any given reason the country is planning on working first or only in the refractive errors, focus on the reset will be a good thing, right? And
Yeah.
if there's resources, working on both will be feasible.
Yeah. And also, you may focus on the reset if an exat has been done within the last, few years, of course. You may focus on a reset if a specific specs initiative is planning within the countries, just to bolster that data to support planning on refractive error.
Okay. One comment regarding the exat and also the population-based studies like the REB. So every time I travel, every time I go to conferences, people from different countries ask me if it's a good fit for a given country, or if it's worth applying resources, money, etc., etc. My general answer is that they are good tools. It's always good to have a situation analysis, but obviously they are tools. They support actions. They support on upcoming national plans. So the answer is yes. If we are planning actions, we are planning to change the way we are doing things, and ideally connected to a national plan. So it's not forbidden to do it locally. It's not forbidden to do it apart from the Minister of Health, etc. But they are tools that support changes in the way we do things at the national level. So yes, if we can act in this sense, and that's what Paraguay is doing at the moment. So one comment from my colleagues from one side, Exolor Luxottica. We have comments from Daniele Cangemi, Judith Williams, and Diana. They say they have been working and engaged the ophthalmologist associations to reach the Ministry of Health, and that's a good way of doing advocacy, not only supporting donation of spectacles or supporting exams, but that's a good way of helping spread the word. That's really helpful. Thank you, Daniele. Una pregunta de Alejandra Corrales: si hay recursos para...
There's a question by Alejandra Corrales. Are there resources for that? Can we request economic support? Thank you, Alejandra, for your comment. Yes, there are resources. And the next topic we have here for the closing point is about this. What is the route? The route is the ministry has to agree in engaging in specs, requesting support from PAHO. This comes to PAHO Washington as a request. It is internally budgeted as part of PAHO tasks with support from WHO to do that. In this way, we can provide technical aid. We don't have financial support to buy spectacles, pay for visits to doctors, etc. I was in Paraguay a couple of months ago as part of a task we have listed as PAHO tasks, and we're doing the same thing in 2026. We do have resources in terms of supporting countries technically. The starting point is to get a request from the ministries at PAHO. And then we check the need, how we can support, what the barriers are. But we can do it, yes. We have ways to do so. So, Alejandra, if it's a priority for the ministry, apply and we'll support you gladly. So, we're getting a little bit excited about the regional roadmap and the call for regional commitments at PAHO and WHO. We're enthused about supporting countries who would like to get into this in 2026. So the starting point, as I said before, is the ministries requesting help. And then we start with the work by sharing all the documents we have, the experiences we had in Paraguay and in other regions. The idea today is to give you some more information, and we'll share a document with you. We are going to share with you the steps you need to take. And in a few days, we're going to share presentations and more details. Now we have Dr. Sanja Cafe, who is interim head of the Healthy Life course at PAHO and also advisor to
Thanks again for your
adolescent health. So
presence
Sanja.
here, and please take the floor.
Thank you very much, Joao. Can you hear me well?
Yes.
Perfect. Excellent. So thank you so much. Muchas gracias for the valuable information. I've been listening carefully, and I see in the chat that the participants showed a lot of interest. And so I'm very happy with that. And as we reach the close of this regional launch of the SPECS 2030 initiative, I want to extend our sincere appreciation to all who have joined this important dialogue, from ministries of health, professional associations, academia, civil society, our partners, our colleagues from WHO and PAHO, and of course, congratulations to you, Joao, Dr. Carolina Holmes, and other colleagues, Brenda, our translators who all have contributed to the success of this event. Today's discussion has reaffirmed a simple but powerful truth. Good vision is essential for good health, for learning, and for livelihoods. Yet, as we have heard this morning, uncorrected refractive errors remain the leading cause of visual impairment in our region, where nearly 78 million people live with vision loss, 3.7 million are blind, and 24.5 million experience moderate to severe vision impairment. Behind these numbers, we have to always remember that behind these numbers, we have millions of children, adolescents, adults who are directly impacted. And we are thinking about our children who are struggling to see the blackboard, adults losing work opportunities, and other older people excluded from daily participation simply because they cannot access a basic pair of glasses. As Dr. Fitzgerald reminded us this morning, across the life course from childhood, learning to adult productivity to healthy aging, vision underpins opportunities for individuals and resilience for societies. This perfectly encapsulates why our collective action through SPECS 2030 is so vital. As we heard through this insightful meeting, the SPECS 2030 initiative provides a clear and actionable framework to change the reality. Its 5 pillars, services, personnel, education, cost, and surveillance, remind us that progress will require a whole of society approach. All of us need to be involved. The commitment shown by Paraguay, who shared their experience with us, illustrates the region's determination to advance eye health for all. These examples that were shared by Paraguay and by the WHO, they show that integrating eye health within universal health coverage is not only feasible, but it transforms. It is transformative when grounded in collaboration and equity. Looking ahead, the next steps are clear. Joao mentioned them, that as PAHO, together with WHO, we are available and ready to work hand in hand with member states to support the development and the implementation of national roadmaps aligned with the 5 pillars of SPECS 2030. We encourage the countries that are present to join the global SPECS network to share lessons, advocate collectively, and to sustain the momentum. The link will be in the chat. Thank you once again for your engagement, for your commitment, and for sharing the vision that we have for healthier eyes and healthier lives for every person in our region. Thank you very much.
Thank you, Sonja, for the wonderful words. Bueno, con eso cerramos la sesión. Como les
With
mencioné,
this, we're going to close our session. As I mentioned, we're going to share the documents. I think that we have lots of information in the chat box, and I would like to mention that we are at your disposal for everything that you need. So together as a region, we could move forward on the topics related to people's health and the quality of life and for all the community. So with that said, thank you and have a beautiful morning, good afternoon, and we will be on touch. Thank you. Bye-bye.